Hi, my name is Samantha Stair. I'll be talking about the right to death for terminally ill patients, also known as physician-assisted suicide. Everyone knows or will know at some point somebody who is terminally ill. Terminal illness becomes untreatable and can cause painful death, sometimes resulting in memory loss or confusion. Physician-assisted suicide should be legalized throughout the country for terminally ill patients. I've known people battling cancer that became untreatable and caused low quality of life, caused memory loss, vomiting, loss of control of the body, all the time while waiting for the inevitable end. Terminal illness is something many people will face in their lifetime. Some states, PAS, known as physician-assisted suicide, is legal. There's a long-standing history on this concept. Having the option to decide when to die peacefully, not painfully, would mean a great deal to a lot of people. We, as humans, should have the right to die with our dignity intact. PAS has been a topic of discussion for a long time. There's a long-standing history of physician-assisted suicide. Ian Dobigan, Ph.D., from the article, A Merciful End, The Euthanasia Movement in Modern America, published in 2003, states that the concept of euthanasia has been around since before 500 BC. In ancient Greece, it was common for physicians to comply to their dying patients by providing them with medicine to end their agony. This is not a new concept. 5 states currently have legalized physician-assisted suicide. From the article, State-by-State Guide to PAS, published October 2015, the first state to legalize PAS was Oregon in 1994, followed by Washington in 2008, Montana in 2009, Vermont in 2013, and California in 2015. As stated in the article, How to Access Death with Dignity Laws, there are many rules to being provided with physician-assisted suicide. In Oregon, Washington, and Vermont, you must be 18 years or older, mentally competent to make the decision, diagnosed with a terminal illness expected to die within 6 months or less. You must be able to self-administer the drug, provide 2 oral requests, each 15 days apart, and 1 written request, also 15 days apart. Physician-assisted suicide is meant to relieve the suffering of terminally ill patients. One reason to legalize PAS would be to relieve suffering for terminally ill patients. As stated by Joe Messerly in the article In a Nutshell, published January 2012, disease can result in slow, agonizing deaths, and doctors are able to determine when days are numbered and a patient has 6 months or less to live. Why force a patient to spend the last 6 months of their life in suffering, vomiting, and losing control of their bodily functions if they wish to die peacefully? Everyone should be able to decide when they are done suffering. Everyone who is terminally ill should have the fundamental right to choose when to end their suffering. This is a country of freedom, and it doesn't seem right to restrict a terminally ill patient to die peacefully instead of painfully. David Swanton in Human Rights, published March 2015, states that Sue Rodriguez, a Canadian who died in 1994 from Lou Gehrig's disease, says that if she cannot give consent to her own death, then whose life is it anyways? We should all have the right to die option to die with dignity. Everyone should have the option to die with dignity, rather than have a terminal illness reduce them to a shell of their former selves. When patients are coming to an end in their life, they can lose control of their own bodily functions, causing them to vomit, drool, lose control of bowel and bladder, and in some cases experience memory loss, things that the majority of people have control of that we take for granted. If people who are terminally ill wish to die with the dignity, pride, and memory still intact, then who are we to stop them? This speech was meant to persuade you that physician-assisted suicide should be legalized in the U.S. There is a long-standing history on this topic, on this powerful, controversial topic. Physician-assisted suicide allows people who are terminally ill to die peacefully at their own disclosure. It has been legal in 5 states and has been successful. Why would we stop people who are terminally ill from dying in the comfort of their own home while they are still themselves?